The CDC says this year's flu shot is a very good match for the strain circulating in the U.S. right now. Here to answer questions is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Hi, Dr. Ellerin.
Hey, Dr. T. Great to see you. So we're going to throw a lot of numbers out there, but I would like to break the numbers down. So let's go. In a typical year, about 60% of Americans get vaccinated against the flu. Right now here in Massachusetts, only 36% of residents have gotten the shot, a little over half. So in your opinion, is that a problem? And if it is, why?
This is a real problem, Eddie. Why? Because the flu season right now in most of the country either has a high or very high numbers, okay, of people getting infected. And so with only 35% of people vaccinated, especially because the vaccine is well matched for the circulating strain, that just means we're going to see more burden of disease. We can't afford that right now. Why? Because we're in a crisis of capacity. When you look at Massachusetts right now, 95% of med-surg beds right now are occupied, 87% of ICU beds. That's a problem. We don't have that surge that we need. It's not winter yet. So we really want people to get vaccinated. Even when the vaccine is not well matched, those that get it have a 35% less likelihood of being hospitalized. So think about that it's well matched right now. Now is the time to roll up your sleeves. It will keep you less likely to get the flu, less likely to get hospitalized.
Mm-hmm. And Dr. Ellerin, it feels like we were just talking about this. Everybody has something right now, and it gives us flashbacks to last year with Omicron when it was on the rise during this time of year. Let's talk about the patients arriving at South Shore with the flu, or is it just the flu, and what are they being hospitalized for?
I'm glad you asked that, Shana, because it's not just the flu right now. We're seeing not only influenza, we're seeing RSV, we're seeing COVID-19, we're seeing other respiratory viruses. It almost seems like we're in a respiratory viral vortex with a mix of all these different types of viruses. And not one necessarily is overwhelming the system, but remember, when we don't have capacity, we need to do everything we can to decrease the number of patients, not just that enter the hospital, but pediatricians right now are in internists and primary care providers. Right now in the United States, when you look at respiratory viral illnesses, it is unprecedented. We've never seen the number of cases of outpatients that are going to visit the clinics because of respiratory infections. It's all just snowballing, and it's becoming very congested. We have to do something.
And let's share even more numbers with our viewers right now. This is the state's vaccination report for specific age groups, and rates are really dragging for kids. 40% today compared to 68% before the pandemic for children younger than 5. And for kids 5 to 12, it's 35% instead of over 54. So why do you think this is? Why is there a lag?
Right. Why are we seeing less vaccination now than we saw pre-pandemic? One thing I want parents to know, COVID-19 is not the only virus that's in the pilot seat right now. Really, when you think about RSV, you've already heard what it's doing to our hospital beds, to the numbers in our pediatric intensive care units. You know, so influenza is also adding to this. So what I want parents to know is by getting your kids vaccinated, they're less likely to miss school. They're less likely to get hospitalized, especially if they're kids that have underlying comorbidities like asthma or diabetes. It's really important. There's never been a more important time right now to get vaccinated. And it's not just to prevent severe illness. It's to try to decrease the burden of the healthcare system right now.
Not the only virus in the pilot seat. Dr. T, well put. Thank you.
Yes, thank you so much. And to our viewers, if you have any health questions that you would like our experts to answer, email them to